our caregiving team, once a patient gets admitted to our hospice, the number one is the RN case manager, and they'll make sure everything that I talk about after this is happening the way it's supposed to for this patient. I liken an RN case manager or nurse to the doctors walking in and seeing the patient. That nurse is going to go out, and if a patient's uncomfortable or needs some kind of medication, we're going to reach out to that doctor immediately and get orders and get those placed in that patient's home almost within a couple hours to get that patient comfortable. Those visits happen a couple times a week, and they increase as needed. If a family member calls us at 1 a.m, they're going to reach a Paradigm employee, and if they need a nursing visit, we will send a nurse out at 1 a.m. on Christmas Day. It doesn't matter when it is, we're going to be there to help them. Next on the list is a CNA. CNA is going to come in typically a couple times a week, can be as needed, sometimes more than that, but most times it's a couple times a week. They're going to do activities of daily living, get that patient up, give them a bath, change their bed sheets. I've seen them do some nail care. I've seen some of our CNAs put makeup on patients, curl their hair, make them feel special for that day. I've also had CNAs take their patients to activities in buildings and spend some extra special time with them that way. Next on the list is social worker. Social worker I liken to a dictionary, like encyclopedia that we all used to get our book reports out of when we were kids. Social workers, they are a good reference point of information for a lot of different information. They can guide a patient and guide a family in the right direction that they need to go. It could be insurance questions. It could be extra care that's needed in the home. It could be respites where they need to go and the caretakers need a break. Or it could be grieving difficulties for the patient or the family. They can come in and help with that. Chaplain, much like it sounds, it's a non-denominational minister coming in. They can pray with the patient and the family. If the patient and the family don't want them to pray, they can come in and they can just be a friend. I had a chaplain tell me once that 65% of their visits are companion care visits where they are coming and they are just sitting and reminiscing with that patient. Next on the list is one of my most favorite things that we do at Paradigm, music therapy. Basically, they're going to come out and serenade that patient with an acoustic guitar, any song they want. But it's not just them playing songs for that patient. They are actually clinical. They have their bachelor's degree. They've done clinical hours to be able to get to this point, and they work on pain, anxiety, breathing, socialization, and a lot of different other things that can help a patient have optimal life, which is what we're doing at Paradigm. Also, we own our own home health portion of our company, so we employ our own therapists, so we can send out physical, occupational, or speech therapy for 2 or 3 visits to get a patient up and going if it's deemed appropriate by the RN case manager. Next on the list is volunteers. Volunteers could range from pet therapy to art enrichment. I had a patient. He had Parkinson's. He was in a nursing home. He shook all the time. He used to build model cars. And we had an 18-year-old high school student, and it gives me goosebumps thinking about it. 18-year-old high school student come in, and he was the hands of that patient, and they built model cars together. So that guy was still able to experience one of his loves through an 18-year-old. Last but not least is bereavement care. Bereavement care, I don't focus on that part at all because we are focusing on that patient living. I want to have them on our hospice to live, and I want them to live well. But after they do pass, we have bereavement that lasts at least 13 months, if not longer. And we can reach out and set them up with intense counseling sessions if we need to. A couple more things I didn't mention. Our medical director, Dr. Deshiani Munising, is one of our medical directors, and then attending physician. You can pick any attending physician you want. You can also use our medical director.